Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. So, Janet, tell me what's going on with your occipital neuralgia.
Okay, I've had headaches for 20 years.
20 years, okay.
Mm-hmm. And when they come on, I can almost clock, have in the past, I'll clock them like every 2 hours. Every 2 hours, they'll start like, I'll start feeling something in the back of my neck, and then they'll just move
shooting up to the front.
Yeah, and then they end up in my eye, and my eye starts crying, watering, and the right side of my nose does. And they last about 20 minutes.
Is that was every day?
And it's like a cycle. And they may last 7 to 10 days.
7 to 10 days.
But it's day and night, 24 hours a day they come on. And I've gone to neurologists, psychologists, I've done acupuncture,
massage, chiropractor,
chiropractor. Anything anybody suggests.
I thought you told me like you did also Botox or something.
And I did try Botox, yes.
Yeah, so you tried everything for 20 years.
Right.
And
nothing.
And every time you get like 7 days, like back to back, and cycle of every half an hour.
Right.
So,
and then I maybe have 2 weeks to 10 days in between, and we start again.
So I know you did telehealth like a month ago to go over your lab, your nutrition, your diet. So can you tell me how do you feel after, we did not do the manual yet, we're going to do the manual therapy now, but how do you feel after changing your diet? You follow the instruction from A to D book, and you started taking the supplements based on your lab. So what that made change?
That has made a big difference.
Okay.
I won't say I haven't had headaches, but they haven't been as close together. They haven't been as severe.
Okay.
I mean, it really has helped.
So you notice the frequency and the intensity has been decreasing. Okay, so for the last month. And what did you have any other issue that helped with the supplements?
I have a lot more energy.
More energy.
It's hard to almost in the afternoon. I have my nap. But since I've just probably noticed it really the last week or so, that
more energy, because it takes time to build up the vitamins in your body. That's good. So today, how much headache, how much tightness do you feel from 0 to 10, and where do you feel?
I feel fine. But when I walked in the office with you 15, 20 minutes ago, I was having a little headache, but it wasn't severe, and it didn't. Usually they start little and then it is.
Since you start the supplements, these things are under control. It's not full blown like before, which is a good sign.
Before it was like I just got ready to kill myself. It was so bad.
So you feel stabbing pain in the arm. Okay, so you're very limited here. You are 40 degrees, it should be 80. Okay, and here you are 45. This one should be 50 or 60. Here it's 40, that is 25. You should be 50. You can see the scar tissue sticking out here. Actually, you can see it here. So side bend to the right. Okay, this is 25 left. That is another 25. Should be 40. Yeah, that's a good idea. You feel the tightness in your fascia here? I'm actually pulling on the fascia and it's pulling the head.
Yes, it is.
Yes, so that's a very tight fascia. So we're going to release this. Look at this. It pulls her whole body.
I feel my scalp pulling.
Yeah, that shows you how tight is your fascia. And when your fascia is tight, the superficial layer is like a wraps around in the entire body. It's like a Spider-Man suit. So when it's tight, it's like you're wearing a t-shirt 2 to 3 sizes too small. It's compressed on everything. It limited range of motion, and that is one. So the triggers for occipital neuralgia, you will have posture restrictions, you will have fibrotic tissue, you will have inflammation, and go over that in depth and how to diagnose occipital neuralgia with you.
Yeah, I noticed that too at one time.
Make sure it's not painful. Okay, Janet, so you had ASTR treatment for occipital neuralgia. Before I do the range of motion to reassess your progress, I want you to briefly tell me your history of occipital neuralgia.
Well, it started, which I didn't know it was what it was, but the headache started 20 years ago. And I've gone to many different doctors, tried many different therapies. In fact, anything anybody would mention that they thought would help, I tried, nothing helped. Headaches day and night, 24/7, like 7 to 10 days at a time.
Oh my goodness.
And night and day, you know, for years.
So you had, did you see physical therapist, chiropractor, massage,
Chiropractor, massage,
neurologist?
right, I
And-
tried.
And even you mentioned to me like you went to a doctor that these are like give you antidepressant and stuff like
Yes,
that.
yes,
Yeah.
they tried 12 different antidepressants on me, and nothing, they just made me feel crazy and didn't really help. And in fact, my neurologist told me, there's nothing you can do about it, just take the medicine for the rest of your life to relieve the pain,
Okay,
but it would heal it.
so you came here for ASTR treatment to work on your occipital neuralgia, and we have the number for the initial range of motion. Do you have headache today? How is your headache?
I haven't had headaches since the day you worked for me. Yes, it's just been wonderful.
That's awesome.
Wonderful.
That's awesome. So we'll take the range of motion and we'll compare it to the initial range of motion. So flexion was 42 and extension was 25. So flexion, this is 50. That was 25. Are you trying to show off now? This is like 665. Okay, so both are back to normal. Okay. Rotation was 40 to the right, 45 to the left. Okay. Turn to 60. Let's go to the other side. 60, and this one is 80. Side bend with 25 each. So side bend this way. And this is 40, the other side. That is 45. Are we back to normal? You're almost back to normal. The only range of motion you're missing is the rotation to the right. But flexion, extension 50 and 65. The normal is 50 to 60.
Okay.
Rotation, the normal 80 to 85. You get normal on one side, the other side. We need to work a little bit more on it, but you have a little bit knot that's very thick, that takes time. But I'm not concerned as long as the headache are under control. Side bend should be 40, 45. She's actually 45 and 40. So we did just a few treatments here.
Right.
And what's your honest opinion about ASTR?
I will say it. I've told everybody it's been a miracle. It has been a miracle. I can't say enough good about it. I mean, I'm so thankful.
Thank you. All right.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.